Retirement or getting older involves a great deal of change in the lifestyle. If you've observed the elderly, you'll be able to connect to this video. The mental health of the elderly is just as important as anybody else's. They're family members, active participants in society, and part of the workforce. They influence everyone. 15% of the elderly experience mental health issues. And no, they aren't an inevitable part of old age. The environment plays such a big role that they can be helped. Now, what causes mental health issues? The search for meaningful engagement in society, losing your daily structure and a reason to wake up, can affect your sense of self-worth and importance if you ever felt valued at work. Prescribed medication can cause side effects, which would eventually cause symptoms related to mental illness. Alcohol abuse, which is quite self-explanatory, affects all ages. However, it is more likely to go unnoticed in the elderly. Now, the first signs of these issues are change in personal care, that is, regular routines not being followed, and social withdrawal. Following, changes in mood can show depression and Alzheimer's disease, and memory issues may show Alzheimer's disease and dementia. The most common mental disorders in the elderly are: first, depression. It's easier to treat the elderly with depression than the general population. They show low motivation, lack of energy, and they have a lot of physical complaints. Hence, risk factors include losing a loved one, heavy drinking, physical illness, and diminished functional status. Second, anxiety disorders. These could show up as sleeping issues, chronic fatigue, anxiety, and physical pain and tense muscles. Now, some types of anxiety disorders are post-traumatic stress disorder, generalized anxiety disorder, social anxiety disorder, obsessive-compulsive disorder, phobias, and some panic disorders. So, phobias are extreme, intense, and paralyzing fears of non-threatening things. For example, driving, germs, flying, or meeting people. Panic disorder shows random intense fear, along with heart palpitations, shaking, sweating, and having difficulty breathing. Next is bipolar disorder. This is a personality disorder that involves manic episodes. Read up more about all of these disorders on our previous pages. Now, how do we help such patients? First, figure out whether this behavior is a result of aging or a mental illness. Then, bring up the topic slowly. Realize that there is a stigma. Know what to expect. Learn about the illness and gather all the information that you can. Visit a professional to understand better. Search and interact with support groups for the elderly, which would allow them to feel heard and understood. As the caregiver, you must effectively communicate. For both of y'all, you have to establish lines of communication with friends, family members, and the doctor. And you have to ensure stress-free areas in your surrounding. Depending on the diagnosis, the professional will present help. Trust that the professional knows what they are doing. Ensure that medications are taken and therapy sessions are attended. Journaling is a technique where you realize that you have an irrational fear and challenge it by asking yourself why continuously. By this, you notice your own negative trends and you can understand what your therapist is trying to tell you. One can also make daily schedules to include exercise plans, food menus, activities, and doing anything that makes the patient happy. In this way, you look forward to doing something every day. Once again, mental health issues are not a part and plan of old age. Accompany the elderly, help them as much as you can, provide the care required, support them, and hear about another success story.